Let's switch gears if we can and talk a little bit about some of the educational initiatives that are starting to help our membership. First would be my understanding with the release of several of the new oral agents for advanced prostate cancer that the AUA is creating a number of regional advanced prostate cancer courses. Is that true?
That's right. I think uh, after so many years, finally we have advances in the treatment of advanced prostate cancer. And we have drugs which can be given orally, and we can help our patient, because patient comes to you right from beginning when he has early stage of cancer, and then you treat him, and then he will develop advanced stage of cancer. He doesn't want to go and see some other physician. If you can provide the same level of care when he develops advanced disease, it's good for the care of the patient, good for the family, good for you. You have developed the bonding. So now we have the drugs which can treat the advanced prostate cancer. But urologists in general are not used to treating advanced cancer. But if we can educate them, I think we can provide that type of care. And that will be the key issue for the Office of Education, to educate our members. And in that regard, what we are planning, in collaboration with the Society of Urological Oncology, we are holding 5 regional educational courses for our members. And that will be starting very soon, and within next 6 to 8 months, what we want to provide is 5 regional courses. These courses will be 2 days each. On the first day, it will be educational. It will be case-based treatment, how to treat with the new drugs, what to expect with the new drugs, side effect of the new drugs. And the second day will be devoted mainly for business aspect, the risk involved, the reimbursement, coding, etc. So it will be a good educational resource for our members in a 2-day, and if you can accomplish by giving it in 5 regions for next several months, it will be a great asset to our membership.
It sounds like it may be very exciting. You're going to include medical oncologists into the teaching format. It sounds too you may be able to bring your business administrator with you, which would be a tremendous benefit to the practice. And then additionally, I think there are going to be a number of experts speaking in the areas and making people feel a little more comfortable with delivering these drugs in their office. So I think it sounds fantastic for the membership. There are other initiatives, though, that I think the membership have been asking for, and I'm so proud to hear that they've happened. Like, for instance, I hear that the Office of Education is now going to offer a recertification course. So for the people that are going to be recertifying, we now have a training course for them, or an update that will allow them to get ready for that test. Correct?
That's right. I think we realize the importance of recertification, and whenever you go for any test, everybody is a little anxious.
Yeah, I would say that's true.
So I think if we can provide that education to our members, if they need that type of training, what we are trying to do is do a recertification review course.
Mm-hmm.
And that will be done in September of this year. It will be 2 to 2.5 day course where they will be exposed to all the latest advances which has occurred over the years.
The other thing that I hear the members say fairly often, and I'm actually in that group, is that, boy, the demand for ultrasound courses has been so great that we can't keep up. And I hear that it sounds to me that we're going to expand that. Is that true? You're going to expand the ultrasound courses this coming year?
That's right. I think this course has been very popular, uh, and members want to preserve this imaging. This is like a stethoscope to a cardiologist. You cannot practice urology without the help of ultrasound. So if and so they are very keen, and this course has been very popular. So we are planning to have 8 additional courses this year to train the urologists about the proper use of ultrasound imaging, which will be not only to the prostate but to kidneys, adrenal, bladder, testes, penile, and so it will be a good educational tool for all the membership.
Great. What about the new workshop that you're going to have for the residency program directors? I hear that will be at the main office.
That's right. I think we realize that there are so many changing in the residency reviews, so many things are changing very fast, and it will be important to have additional course for the program directors, and we are planning to do that early next year, maybe January or February.
Great.
And it will be a great thing.
Yeah, I know with the new accreditation system, everything's changing, and all the program directors are so concerned about how they're going to incorporate that. What do we do to make those changes happen in our institution? So it sounds like that'll be a tremendous benefit. Anything else that you can think of from the Office of Education benefiting membership that you'd like to speak about?
Yeah, I think the AUA is trying to develop in-house learning, online learning management systems, and that will be another resource for improving online learning. And that doesn't mean to say that that will replace our annual meeting, which is so important, but that will be additional to the annual meeting educational resource. So online learning system is going to come and will enhance. The other thing which we are considering is, as we heard yesterday, simulation or not simulation. There is some people think the simulation is going to be very helpful. Another thing, we don't know whether it's really necessary. So we are going to explore, and we are trying to see if we can have some simulation center to enhance the education of residents in that regard.
You know, that's interesting because as a pilot myself, we use simulation an awful lot. And when we incorporated the simulation for the robot into our robotic training program, we found that the junior residents got very quickly incorporated suturing and doing some maneuvering with the robot that they couldn't do. And it was very difficult to find the time on the patient console, so it was nice to use simulation. So I see this, as many specialties do, as the wave of the future. I think it's going to happen, don't you?
Right, I truly believe it. I think that's the way to go. Before you practice on the patient, you should practice in your own way and learn it before you try it. That will improve the treatment significantly.
Is there key legislation now that the AUA is supporting?
Yeah, we have some legislation which we are focusing mainly. Some we partner with other affiliated programs. And of interest to all the members is every few months we have been hearing about how can we fix the SGR. And I think this is the 1 year if we can get it fixed. It's SGR is on sale right now.
Right.
If we can get 138 billion, this is the best time to fix it once forever.
Right.
So we are working hard in that regard. We are also trying to see if we can modify the IPAB, Independent Payment Advisory Board, because as you know, this board was created by President, and its not accountable to Congress, and whatever they will decide, their main job is to cut down the expenses of CMS. And there is not a single physician in that board. So we are trying to see if we can repeal that and modify that. So that will be a great thing for.
Yeah, I think people are really concerned about the IPAB and having people make decisions that they are made so early, and Congress wouldn't have time to repeal any of their decisions. They would basically be shot straight through. It sounds like it's very powerful in the way that's written right now, and it doesn't sound like any active physician can sit on that board. So it sounds like a real problem, and I know the membership's been concerned about that. Are there any other initiatives or anything else that you'd like to add to this that you think is important for the readership to hear about?
Right, I think we should, as I mentioned, we are going to try our best to preserve the in-office ancillary exception. We should continue in that regard. We'll try to get some more GME fundings, because it looks like it's a matter of demand and supply. We need more urologists. The supply is going to be less, and unless we improve the GME funding to train more residents, so that will be a key issue to convince the lawmakers that this is the time to improve the funding. Unfortunately, when the Balanced Budget Act was discussed in late 1900s, they didn't realize that things will change, and now we are seeing that we need, demand is more, but the supply is getting less. Right. So that will be very important to look into and see if we can convince them to improve the GME funding.
Great. Well, thank you very much for visiting with us today. We really appreciate it.
Thank you.
Look forward to your presidency.